to the second webinar of the Health Data Exploration Project, or the HDE. This is a webinar series that we initiated starting last month. My name is Cinnamon Blass. I'm an investigator in the HDE and a faculty member at UC San Diego. The HDE is a Robert Wood Johnson Foundation-funded project based at here at the California Institute for Telecommunications and Information Technology, or CalIT2, here at UC San Diego. The project is led by Dr. Kevin Patrick, together with a multidisciplinary group of investigators and industry leaders in data science, medicine, engineering, ethics, and many other areas. And we would very much like to thank you all for joining us this morning. This is Matt Beetz, who is a lead co-investigator on the project. So as many of you know, the goal of the HDE is to explore barriers and facilitators to the use of personal health data in public health research, or research for the greater good. We define personal health data very broadly to include, for example, data from wearable sensors, smartphone apps, digital trace data, even personal genome and personal microbiome data. And before we get started with today's webinar, which I'm really looking forward to, I want to let everybody who's tuning in know that a major part of what we're doing in the HDE is working to actually build a network of individuals that represent all of the varied stakeholders in this area of personal health data. And we currently have over 60 individual and company members in this network, but we are very much looking to expand that network. There are several membership perks, including opportunities to broaden your network and connect with other researchers and innovators in the personal health data space, possibly access to future pilot grant opportunities, also opportunities to receive important updates regarding broader activities in the area of personal health data. And you'll be hearing some of those updates actually today in the context of the webinar. As such, I'd like to really strongly encourage you to sign up to join our network on our website, and the web address is hdexplore.calit2.net. And so with that background, I'd like to introduce today's webinar, which is entitled Advancing the Ethical Conduct of 21st Century Research. We're very fortunate today to have Dr. Camille Nebeker, who is a faculty member here at UC San Diego, leading the discussion on this very important topic, and she'll kind of draw the connections of some of the ethical issues that are raised in the context of new and emerging personal health data technologies. And I'll let her introduce herself and give a bit of her background. But suffice it to say, she's been working in the area of research ethics for many, many years, and is really a leader on this topic. So we're fortunate to have her today. We're also going to be joined by two primary discussants. Camille will give a short slide-based presentation, and then we want to have kind of an engaged discussion that involves two additional discussants who I'll introduce in a moment, as well as questions from you all who are viewing the webinar currently. And so our two discussants, the first one is Isha Bhandari. She's a staff attorney with the ACLU's Speech Privacy and Technology Project, and I'll let her introduce herself a bit more and explain her interest in this area. And also we're fortunate to be joined by Dr. Rumi Shinara, who is an assistant professor at New York University in computer science and engineering. And so I'll let her explain her interest as well. So thank you again, everybody, for joining us this morning, and I'll turn it over to Camille.
Hi, good morning. Thank you, Cinnamon. That was a great introduction. Just to take a minute before we get started, as Cinnamon mentioned, I'm in the Department of Family Medicine and Public Health. Our name just changed recently. And I've been involved with research ethics for nearly 20 years. I've served on IRBs for close to 20 years, and I'm also in the Division of Behavioral Medicine. And I look forward to presenting today. Thanks. Is our Rumi and
Isha, do you want to introduce yourself?
Sure. Hi. Thanks for inviting me to participate. My name is Isha Bhandari. I am a staff attorney with the ACLU's Speech Privacy and Technology Project. And one of the reasons that I'm interested in this, the topic of this webinar and research ethics generally is the ACLU comes at these issues from a civil rights perspective. And I would say two main issues, or two main sides of the debate. One is ensuring that there is robust protection for academic freedom in the United States. Ensuring that the First Amendment values are reflected in scientific inquiry and the freedom of academics to pursue valuable research. And then the second angle that we look at is also privacy protections for individuals who are involved in this research. Ensuring that the civil rights concerns that can come on that side involving individual privacy and consent and use of information is appropriately weighed and balanced in any research that happens. So those are the two main angles that I come at this topic from.
Rumi, do you want to introduce yourself?
Sure. Thanks so much for having me, the team there. My name is Rumi Chunara. My research here at NYU is mostly focused on understanding disease spread in populations, both from the infectious, event-based side, as well as looking at risk factors for non-communicable disease. In doing so, we harness a lot of data that comes outside of the traditional healthcare system, so from all the way from social media and other internet-based data to crowdsourcing molecular specimens from individuals. And so, I met Camille obviously through a couple different venues and got to talking about some of our experiences, especially, exactly in doing research on this side. I'm sure other folks out there have their own experience as well, working through IRBs. And so, really looking forward to discussing kind of our experiences and brainstorming about going forward.
Great. Thank you for those introductory remarks. Looking forward to the discussion. Camille, do you want to kick things off with your presentation?
Yeah.
Hi guys.
Yeah. Thanks.
Set up here. There we go. All right.
Thanks, Joe. So hi again, everybody. This is a real pleasure to be a part of this webinar. I wanted to just kind of go back a couple years in time and talk about how I got involved in wanting to think more about emerging technologies and how to conduct the research that uses these emerging technologies ethically. And one of the things that I was noticing as an IRB member and a faculty member in behavioral medicine was that there was a growing gap between what the IRBs understood about technologies, some decisions that they were making, and the impact that it was having on the science. And so that's what got me involved in this. And over the past couple of years, I've had some really incredible collaborators who have helped me think about these issues, who have helped collect data about what participants are thinking, and have helped me do some of the research that I'm going to talk about today. So I just wanted to make sure to acknowledge all of these great folks before I got started on this. So the objectives of this talk today are to pay attention to what kind of research methods and tools are being used and how those have changed over the past 50 years. And one of the things that I think it's really important that we pay attention to is it was in 1965-66 that the idea that we should have an institutional review board was first introduced, and this was after the publication of many egregious cases where people who were participants in research were harmed. So the idea is if we could get a peer review system in place to help researchers design and conduct their research ethically, then everyone would benefit from it. But that system that we've had in place has not changed over the years. It's not really keeping up with the science of today. So I want to talk a little bit about that. Also talk about some of the new ethical challenges that are introduced by these technologies, and then talk with you about how we could move this forward. I use the acronym MISST, which is mobile imaging, pervasive sensing, social media, and location tracking ethics. And so that's just an umbrella term that I use to cover those different types of technologies. And then I want to talk with you about how we could work with basically a stakeholder group where we as investigators, as IRB members, as members of the public work together to try to create an ethical learning system. So in terms of the characteristics of 21st century research, our methods and tools are very different. So nowadays we can monitor people 24 hours a day, 7 days a week. We can do it in real time. And research isn't exclusively an academic activity anymore. There's more and more industry and not-for-profit groups that are participating actively and engaging the public in research. And the rules are different. So in the academic environment, we have federal regulations that we have to adhere to, and that's an agreement between an academic institution that receives federal funding. Other companies, other organizations don't have those same rules, so we're trying to figure out what's the intersect between how do we collaborate with each other when we have different rules to follow. And then the other thing that we're really challenged with is that we have the technologies are producing so much data, and much of this data is being captured outside of the person's electronic health record. So HIPAA regulations don't necessarily transfer over into what kind of data protections might be needed for this new type of research. And as we've dealt with genomics data, with other types of data that we're collecting, anonymity cannot necessarily be guaranteed anymore. So I'm going to take you along a case study that really got me involved in this area of research, and it's a study that Dr. Jacqueline Kerr at UC San Diego was conducting, and what they were doing is asking people, healthy people who were ranging in age from 6 years old to 85 years old, to wear different types of technology so that they could observe how people behave in their day-to-day life. They asked them actually to wear a camera that was hanging around a lanyard on a person's neck. So you can see my model Brittany here. It has a little red circle around the camera that she's wearing on her chest, and it faces outward, and it takes images of whatever Brittany sees about every 7 seconds. And so the participants in this study would wear that camera for 7 days a week. Also around her wrists, she's got an accelerometer on. Around her waist, she has both an accelerometer and she has a GPS tracking system. So those were the technologies that they were asking participants to wear. And so this is the type of data that's produced from these technologies. So you can see what a person is seeing, first-person point of view. You can get a sense of what kind of tracking the GPS technologies are capturing, and the activity monitor is showing when people are standing up or sitting down or moving. So that's the kind of data that was captured for this study. Now, other studies are using commercial products, and this is a tracking technology that can actually identify every single place this person comes and goes from. So in this case, the grocery store is the target of this image here, and it's showing where the person is coming from when they go to the store, where they're going to, what day of the week they shop, and that kind of detail. So what happens then when new technology meets the institutional review board? So in this case, where they're using a wearable camera, GPS, activity monitoring, the IRB during their first review did a risk-benefit analysis, and they found the camera use to be very problematic, not to the participant in the study, but to the non-participants. So the people who could be imaged as a result of being in the vicinity of a human subject, that was the greatest risk that the committee identified, and they thought that that risk exceeded any benefits, and so their conclusion was that the study could move forward provided the camera was taken away. And so, being that this was an NIH-funded study and the camera was a critical measurement tool, the investigators went back and they asked if they could do these different measures to increase participant protections. Could they move forward and use the camera? The second review said, well, basically, you can use your camera, but you have to blur the images of any person that is captured by that camera that isn't a subject. So that actually increased potential risk because at the time, the only way to blur images was to outsource the service to a third-party vendor, which meant that all of the images would have to be sent to somebody else, and that actually would increase the risk because of the lack of security. So by the time the third review came, the investigators and the IRB were able to come to some agreement, and a lot of the stipulations were thought to increase protections to human subjects. But what's interesting is we really don't know what the human subjects think of these protections, nor do we know what they think they need to be protected from. We don't know what the third parties, or not really third parties, but the bystanders are thinking. You know, does this matter to them that they're being captured in a device? And the device can be an imaging device, but it could also be an audio device. So we did 3 different studies so far, and we're starting to do more of these. But we asked people who were in the iWatch study what they thought. And so we now have a paper under review that reports on what they thought about the informed consent process, their experience wearing the devices, privacy issues, what people who they were around thought of it, and we also watched how they would view their images after they completed the study. And we looked to see whether or not the acceptability of these technologies varied across different underserved communities in our vicinity. And so my colleague collected data from the Somali refugee community, the Latino community, and the Native Hawaiian Pacific Islanders. And the third study that we did, which is published, was a content analysis of 8 protocols that were reviewed by 4 different IRBs at UCSD to see what was happening in terms of risk assessment, consistency, and recommendations for risk management. And so basically the primary issues that we're finding really focus on informed consent, assessing the probability and magnitude of benefit and risk, identifying what the rights are of what we call bycatch or bystanders, people that are captured as a result of being near a human subject. And then the data management standards. Not only is this science happening interdisciplinary, and the standards vary across these disciplines, but we really don't have standards in place for guiding the data management. So what concerns the researchers here is that having to rely on IRBs to make these decisions when they lack the expertise. There is a capacity overload issue. Oftentimes the decisions that they make are arbitrary, they're inconsistent, and in fact this could be halting people from pursuing lines of research that is incredibly important to advancing human health. And this actually was taken from a book that was recently published by Carl Schneider called The Censor's Hand. So I'm asking you at this point, is it time for a paradigm shift? Is it time for us to start thinking about how can we contribute to developing a system that is responsive to 21st century research methods and tools? Do we keep it as it is, or do we transition to something new? Or do we create a hybrid? How do we move this forward so our research can be advanced? And what I envision is engaging stakeholders. That includes the people who are innovating the devices, the people who are participants in research, people like you who conduct research, and the IRB members to work in a collaborative way to advance ethical and responsible research practices in this space. So to do that, we are proposing a connected and open research ethics, or what we call the core. And we're at the very beginning of this process. And so what I'd like to do is ask you, people in the audience who are researchers using these kind of tools and technologies, how would you like to be involved? What would help you the most? And then we're also going to be engaging IRB professionals, participants, and starting to really bring together these stakeholders to shape what I'm calling a learning ethics system. So if you're interested in participating, this is a great time to start thinking about it and asking questions about it through our webinar today. So that concludes my presentation, and I look forward to the discussion, and thanks for participating.
Great.
Thanks.
Camille. So So I think you raised a lot of really important and perhaps provocative issues and questions. So maybe I'll turn to Isha to maybe kick it off with some of your thoughts.
Sure, thanks very much. You know, Camille, I think your presentation raises a lot of issues that you know, are not only pressing for the research community, but from my perspective, we're seeing governments, government agencies, and corporations dealing with these issues as well. So I think this is an ideal time to have this conversation about, you know, advancing the goals of various groups while protecting individual privacy, individual data, you know, and striking the right balance between harnessing technology, not stifling research, not stifling, you know, the goals of governmental agencies, but putting in place principles that can protect people. You know, a few reactions to what she said as far as general principles go. I think one area that presents a challenge in this new era of using technology is informed consent. And your example highlighted that, where you have not only, you know, primary subjects of research, but there may be people tangentially affected by the collection of data, and how do you deal with informed consent? You know, I think one area for, you know, that would be ripe for developing standards is, you know, what sort of informed consent should be required when data is used that was originally collected for a different purpose. I'm not sure the extent to which the research community will be, you know, using commercially available databases or information that was collected for, you know, government purposes, but I think one big question area will be, you know, what are the ethical guidelines around using data that people may have initially given up for one purpose and, you know, would now be useful for research, but the individuals themselves may not have consented to that. I think another area that your presentation raised is how to safeguard data once it is in the possession of researchers, once it's been collected or acquired. And again, here I think there's some principles that can be applied, and the hope is that they would be applied consistently so that they're not a cover for stifling research. But you know, I think some standards that can be examined include the use of encryption, particularly when you're talking about personally identifiable information or particularly sensitive data information, such as, you know, names, addresses, social security information, genetic information, you know, things that really are unique to individuals and you know, may benefit from privacy policies that deal with encryption, limiting access to outside parties. Camille, you mentioned the, you know, the problems with using third-party vendors. I think the more sensitive the data collected, the more incumbent it is to have a protocol for third-party access. I think there should be retention policies. You know, how long does a researcher retain data, especially, you know, sensitive data, and you know, building in perhaps in a research protocol a plan for disposing of data, especially if it's sensitive. Another issue was notice to parties regarding data breaches. This is an area that I think isn't properly developed, at least as far as government agencies go so far. It's tended to be ad hoc, and the agencies evaluate whether the data breach was serious enough to inform the people whose data was affected. And I think the research community also similarly needs to come up with you know, principles around notifying individuals when their data has been breached, because that's an important you know, way for individuals to protect their own privacy, to evaluate the risks to them personally if their data falls into other hands. And then lastly, I would mention you know, assessing an impact on marginalized communities. You know, to see whether the risks and burdens of data collection are falling more heavily on them. You know, if there's a potential risk of their data being misused in a way, you know, for example, big data in a corporate environment being used to engage in discrimination on racial or gender or other lines, and whether there are ways that researchers can minimize those impacts. So that's just an outline of, I think, general areas where the research community could come up with generalizable principles in developing a new ethics for the 21st century.
Some great points. Rumi, did you want to respond?
Yeah, thanks, Camille and Esha, for your points. Yeah, just some initial reactions from my side. I think I agree with Esha completely. It's a great conversation and very timely to be had, and appreciate all the work that, Camille, you've put into this area. It brings both of the I guess areas of need that were brought up, including this idea of, okay, privacy and consent from the individual whose data will be used, as well as the idea of ethical oversight on research, to me, are a little bit linked by the idea that these days there's just a higher amount of information, let's say data, and then perhaps information, if you choose to word it as such, available. And so we have to be cognizant of educating people at all spectrums to make decisions correctly, and be understanding, as we can be philosophical to some previous very famous folks, and think about understanding what decisions we ourselves are capable to make, or who should be the right person to make the decision. And so in this sense, I'd like to also highlight that our experience with folks signing up for studies and playing a role, sometimes it's just we're sure that people are just not clear about what's happening. We try and make things very understandable, but it's difficult to assess. Camille, you're doing some good work in trying to assess what people can understand, what they're understanding from different ways things are coming across. But I think that's a very tricky point. And then B, our experience in working with folks who are doing oversight right now in terms of ethics and their levels of knowledge, and if they are the correct people to be doing this. For example, some of the areas which Esha pointed out in terms of retaining data, how long data will be retained. Sure, it would be good to think about those new issues now and provide some specific guidelines that make sense to the community in general. But how about when a new security technique arises, gets developed, in which data can now be communicated for only a discrete length of time? I'm saying this is hypothetical, maybe it exists right now. So in that regard, what I'm really saying is that privacy is a moving target. Sometimes it's difficult to anticipate what should be private now and what could be private later, etc. And so in that sense, I really support Camille's, what she came to at the end of the presentation in terms of a more dynamic way of assessing oversight and kind of thinking in that regard. And this is something I think is really a valuable idea, and would like to hear more from folks who have experiences or what we'd like to see in that kind of model. Thanks.
Thanks, Rumi and Isha. That was really, really helpful. And I think you're bringing up some excellent points, that it has to be a dynamic learning system, and we have to work collaboratively, and that the researchers really do have the expertise. You're working with the participants, and you're the folks that are actually out there getting informed consent, using tools that are very much aligned with protecting institutions and not necessarily encouraging voluntary participation through an informed individual. So I think these issues about informed consent, about data management, about data security, we have to be nimble enough to recognize when even what we think is cutting edge is maybe becoming obsolete. And what I'm envisioning is if we have this core concept, if it becomes a web-based prototype platform where we can all go to one place and find what we believe to be the best practices, and then rate those practices, so that if those practices become obsolete, we replace them with something new. So it really is going to have to be fluid. And it concerns me a little bit about this notice of proposed rulemaking that the Department of Health and Human Services has just put out, that is the the most recent possible change to the common rule, which is the rules that govern IRB regulations. And so since 1991, our federal regulations have been static in this area. This is the first time we have an opportunity to change those regulations, and yet at the same time, those regulations are going to be static again. And so we have an opportunity right now to voice and to respond. It's open for public comment until, I think, early December. So I think it's going to be really important for the HDE network to chime in on how these new static regulations are going to either foster and facilitate this research or actually increase barriers to moving forward.
Those are all great points, and Camille, I'm glad you brought up the notice of proposed rulemaking. I don't want to put anyone on the spot, and I'm not sure if Frumi and Isha, you've had a chance to review that document. It's very long. It's over 500 pages, I believe. But I'd be curious, just if you have had a chance to read any of the announcements about it, or go through it more closely, what are your reactions to that document in particular? Isha, one of the points you raised in your introductory remarks was this issue of how I guess oversight processes may limit the types of research we can do, and kind of under the guise of free speech. So if you have any thoughts on that, I'd be really curious to hear them.
Yeah, I had a chance to take a look at it, and one of my reactions on the free speech side is my understanding from speaking to researchers, particularly those in the social sciences, is that a lot of research that had minimal to no human impact was being stifled, or there was inconsistent application of the common rule, as filtered through IRBs. And I should say at the outset, from a First Amendment perspective, I think public universities have a constitutional responsibility to ensure that they're not applying IRB rules in such a way that is actually shutting down socially valuable research. By that I mean not being driven by ideological or philosophical differences. In other words, it's not the viewpoint or the outcome proposed by the researcher that's driving concerns. That there's a process that's actually taking into account actual risks to humans. So I think to the extent that the new proposed rules would exempt certain areas of research from having to go through the IRB process, that would apply to more more invasive types of research. To that extent, I think it's a good thing. Of course, it remains to be seen whether that process will be implemented consistently. I do think that the rules don't account for an appeal process, which I think would be an important avenue for preserving academic freedom and speech rights, because I think to the extent that there's inconsistent application of the rules, appeal would ensure that, in fact, it's not ideological concerns or viewpoint-based concerns that are restricting research. And my other reaction to the notice of proposed rulemaking is it does leave privacy protections as a bit of a black box. I think it acknowledges the importance of those protections and that they should be reasonable, but it doesn't specifically delineate those standards. And I think that is something that the research community has to to discuss, because as I agree it has to be a dynamic process, but I think that there can be more than I saw in the notice of proposed rulemaking.
Chance to chime in.
I'm sorry, I missed that, Cinnamon. What did you say?
I wanted to give Rumi a chance to chime in.
Thanks. Yeah, I just unmuted myself. Yeah, it was very interesting to read these. I didn't, of course, go through the whole document, but saw some of the bullet points highlighted on the HHS website. I think, yeah, I'm not as qualified like someone as Esha to comment on some of the areas there, and actually she brings up some good points about academic freedom that I appreciate. But I would just highlight some of the initial reactions. I mean, I think it's good that there's an update. Okay, that's in itself very good and somewhat timely. In some sense, as Yesha mentioned, sometimes there's this issue of inconsistent applications of rules. Having, been a PI at multiple different institutions over time, I've witnessed this as well, which is often quite confusing and unnecessarily time-consuming. So, in some sense, this updated rules are interesting, but how those translate to the process with the researcher, I think that area potentially needs some attention, and something like an appeal process that was mentioned is a very good idea. Let's see if I just looked it up briefly to see if I have any other reactions. Yeah, again, it's just I hope for me I've kind of just organically realized that sometimes the folks in the IRB, of course, everyone's well-intentioned, but there's not any, it doesn't seem to be any standardization in terms of process or required updates to their training. So these types of things I think also need an update, which again ties into our whole conversation.
And I think, with these new regulations, it really is up to the individual institutions to put them into play. And institutions view the regulations as a minimal standard. In fact, even today, we have a category called exempt that could, in fact, be determined by researchers if the institutions would allow that. And I think we really need to increase the ability of researchers to make decisions and actually increase the trust of who researchers are in the stakeholder group. So if we have what might be now called an excuse category, that would be really important for institutions to give researchers the autonomy to be able to make decisions. But in my experience, my hunch is that IRBs will create systems or some kind of process that will be another hoop to jump through. So I really would like to see a lot more, again, autonomy for researchers to make decisions when they're doing research that doesn't exceed a minimal risk.
One thing I might add, and I didn't see this addressed in the notice of proposed rulemaking, and I think transparency is another value that can be added to this conversation. To the extent that, Camille, as you mentioned, IRBs and institutions often go above and beyond what the common rule requires, and that can lead to inconsistency within a field. Some sort of transparency about the rules that are applied and the decisions that are made could increase the ability of consistent outcomes. And I also think the transparency would go towards the data management and informed consent that each institution requires, so that individuals who are part of research, have a sort of a sense of what the rules are that are governing this institution. And I think there is a space for transparency to protect academic freedom and to protect individuals.
And I think, empowering the researchers means that they have to have a willingness to know some of these rules and not completely rely on IRBs to make all of those decisions for them. And so, but where do you fit that learning into what is our, so how I view this is that we have all of these siloed researchers across an institution that are all experiencing similar problems, but they're siloed. So how do we collectively bring the research community together so that they can actually affect change?
Do you want to remind people how to submit questions?
Oh yeah, and I'll just point out as well that if anyone has questions to participate and ask questions, you do need to be participating through our Hangouts link, not just by watching on YouTube. But if you go to our website and click on the link there, you'll be able to join the webinar and pose questions. If you don't see the questions tab at the top right, just above the video window, you'll see something that looks like a grid with squares in it, or sort of a grid pattern. If you click on that and you choose Q&A, you'll then be able to see the questions that we have and pose questions of your own, and we'll be bringing those into the discussion. So I think maybe now this is a good chance to do that with the question that we have posted. That's, if I work at an institution that has a fairly traditional approach to these issues with its IRB, what is the best way to move their thinking forward? And a related question, is this issue being discussed in productive ways at national meetings of IRB folks? Does anyone want to respond to that?
Well, in terms of the second part of that question, this year there is an organization called Public Responsibility in Medicine and Research, and that is the national association that IRB professionals, researchers, IRB committee members, and administrators and federal government folks come together. And so that meeting is held annually. This year it's in Boston. And they've dedicated an entire day on social, behavioral, educational research, which SBER is the acronym that they use. And so this is a concerted effort on the part of IRB professionals to become more aware of what these issues are, what kind of things they should be thinking about, so that there could be an increase in consistency. So that's an area that I think is slowly moving forward. But again, one of the things that I think either Rumi or Esha brought up is that there are close to 6,000 IRBs across the nation, and they all are going to have different institutional rules. Some of them will be, moderately consistent, but that's that introduces the potential for a lot of variability. And so these meetings are a chance to get people into the same room to talk about how should we be moving this forward. And I think, I'll be involved in that meeting, and they've invited several researchers who are using these technologies, so it gives us an opportunity to educate that group. But my concern is that technology keeps moving faster than these meetings will take place. So I think we really have to be thoughtful about how do we, as a research community, continue to inform how we should be doing this. So I really want to put more responsibility on researchers who know what the technology is, they know how their subjects are involved, they know what the responses are of participants. And so I think we need to do more of engagement with the research community as a stakeholder. What was the first part, Matt, the first part of the question?
The first part was sort of the question of how do we work, if I'm a researcher, how do we move our conversation forward with the IRB? Is there a way that as a researcher, I think the part of the question is how can a researcher help an IRB at their local institution move forward on some of these?
Well, I think that's something that's... Oh, go ahead, Rumi.
Yes, sorry to interrupt. I thought maybe I'll give some thoughts from my experience, which is not perfect, but just some ideas. One thing that we have found helpful in collaboration with other folks as PIs is actually sometimes just reference things in our IRB proposals, so and give examples of where this has previously been done. Like maybe I forget what the acronym is, but there's a, let me just look it up. For example, if we've had others different parts of the federal agencies, for example, Substance Abuse and Mental Health Services Administration, that provide some guidelines, and we're kind of look through there to see how our work ties in to what's being said there. Give examples of previous IRB applications that have related aspects, and try to give them concrete examples of kind of what's been done, and perhaps that can be done for someone who hasn't maybe worked in that space to talk with other researchers. I know everyone's busy, but if folks have the time, perhaps that's something would be nice to kind of establish maybe in the HDE network or other place some cataloging of IRB experiences, that description of studies and what their proposals look like. That would be helpful for new investigators to kind of refer to and help with their IRBs who may not be haven't seen those experiences. That's one idea.
and that's something really that we're trying to advance through this core project. And the idea would be that researchers would bring their best practices and share them so that everybody would know where to go. So here locally, we've been identifying gaps with how investigators should be describing what they're doing when they're using GPS technology. And so we have several protocols that have been approved and vetted. Now, if we can share those someplace so that other researchers who are starting to use these technologies know exactly where to go, they can see that this type of verbiage has been approved and vetted, and they can adopt it. And they can then cite, this came from the core, and that's researchers who are actually contributing best practices and advancing them as they move forward. So that's one thing that's happening. And locally, I think it's also important for investigators to get together when they're noticing a disconnect between the research and the IRB, and actually convening meetings, getting together and in silos you will all have the same experiences by yourselves, but if you can start communicating with each other, then it ends up saving everybody time and improving the practices.
So, quick question. Camille, I think you clearly have a vision for how we could potentially do this better, so I think that's really interesting to hear about. On the other hand, you talk about, we have over 6,000 IRBs in the U.S. This is a system that has been around for a very long time. It's fairly entrenched, but we want to do it better. So one question is, and you also talked about how different institutions kind of tend to be more conservative than the federal regulations. So what are some thoughts about how you can kind of incentivize or motivate institutions to perhaps, adopt different practices? It often seems to me, kind of thinking about this from an ethics standpoint, but also as a researcher who's submitted several protocols to the IRB, that really there's an incentive to be more conservative, to be more cautious, and so I don't know. I'm wondering what your thoughts are on that.
That's a tough one, because how do you incentivize an IRB to be proactive and progressive when they're worried about lawsuits? I mean, that's kind of where their thinking goes. But I mean, I am thinking kind of an outside the box idea. I mean, I think there is a time for a change, and that's why I brought up the paradigm shift. I mean, that takes a lot of time, but it has to start someplace. And there's actually researchers who are studying this area of transition management. So people in the policy domain that can, they have a framework for how do you move a embedded system forward. So like the pension systems were one of those kinds of systems that they cannot be sustained. So you have to start moving it, and there's actually theory on how do you make those transitions. So I'm really interested in learning more about this transition management ideology. And outside the box thinking, funders could have an influence on this. I mean, if we create a system that has credibility, that has, cutting edge resources, and if funding agencies know it's there, they can say, well, if you're not using the core, we're not going to advance your funding. So just an outside of the box thought. I mean, it's worth dreaming about. I just see that there is, I just can't see this system sustaining itself.
And I would add to that, Camille talking about a paradigm shift, I think that a return to the principles of academic freedom, and again, this I imagine would be a long conversation, but public institutions having a responsibility to not interfere with free inquiry, absent substantial and compelling reasons, sort of shifting the thinking that it shouldn't, the IRB shouldn't exist to shut down research. It should exist to allow research to go forward with only that amount of oversight that's necessary to effectuate those substantial interests in protecting individuals. But beyond that, it's not meant to sit as a body to judge, the sort of kind of other extraneous issues that seem to creep into the system.
Yeah, maybe. Oh, sorry, Matt. Okay, just a quick second. Yeah, I just wanted to kind of concur with what Camille and Isha, sorry if I keep pronouncing your name wrong, said. And Cinnamon, yeah, I agree. I kind of was a new PI, maybe faced with similar things, and a little bit shocked, to be honest, at the beginning, my interactions with IRBs. I thought the idea was it's a group to help researchers make sure, work with you to continue your research, but make sure there's ethical oversight. Whereas sometimes I'm faced with the feeling, like Esha alluded to, that they're working against me to just shut down research. And that ideally that whole concept needs a little bit of clarity in terms of what we're doing here.
We have another question that's come in from Paul Reinhardt that I think is apropos here, and it's something that I'm curious about too. I think I have anecdotal evidence for this, but Paul asks, I'm curious to what extent do these issues cause research to move outside academia to private companies where IRBs are not in effect or are not so stringent? Do you see that happening, and is there something that we should be doing about that?
I don't have data on how much of that is happening, but I certainly can understand why researchers who want to collaborate with industry might be having difficulties doing that. And I think this is a really opportune time to start working with those who are just now starting to develop their own rules for ethics review, organizations that are just now getting involved into the health research area. I don't think that they're going to want to model an ethics review system after what we do. So I don't know how many people are moving in that direction, but I can certainly see why it would be attractive.
Yeah, I know. My field is more on information science and people working with big data to answer questions about sociology a little more generally. And I know there I've seen a lot of people who have, anecdotes. I don't know numbers, but I do know of people who have left academia in part because they couldn't get access to the data that they needed to do what they wanted to do when they were in academia. And so by going to Facebook or Twitter or other large companies, they could actually access data streams that were not available to them as academics because of IRB.
And I think there's a delicate balance there because we really do want to advance ethical research. So getting around it because there's too many rules, is it the rules? Or are they able to continue to conduct ethical research outside of these boundaries? And I think that's an important distinction, is we really do want to advance ethical practices. And there are people who don't have these rules, who are not supported by federal funds, that don't have an IRB. And I think if we had a place where they could come to get consultation, it would be helpful to them. So, I mean, I just think that there's a need for a resource that can help bridge this gap.
Great. Well, we're getting ready to wrap up. Before we do, I wanted to make a couple of announcements. First, I'd like to encourage everyone to join the Health Data Exploration Network. You can do that at our website, hdexplore.calit2.net. You'll also be able to join our mailing list there, and that's really the best way to both start to network with other people in our network, start to learn about what's going on, but also to get the updates that we send out. And you can also see the news that we post. We post both news about our network members and about things that are happening on the web. So it's a great place to sort of keep up to date on what's going on in this space. I also wanted to mention a couple of events that are coming up. First, we're going to be having a conference call in probably about 2 weeks. We're working on setting a date specifically to discuss the changes that are proposed, the proposed changes from HHS to the Common Rule and their notice of proposed rulemaking. So we're going to have a very focused conference call about that. Again, we'll be announcing that to our network, posting the time on our website, but the best way to find out about that is to join our network so that you can get our updates. The other thing I'll mention is that we're running a workshop on industry academic collaborations and partnerships to enable precision medicine at the Health 2.0 conference on Monday, October 5th in Santa Clara, California. We're going to have Brian Sivak from Robert Wood Johnson Foundation moderating a dialogue with leading figures, including Stephen Friend of Sage Bionetworks and Apple, and Ron Gilad-Bachrach of Microsoft Research, to talk really about how to create these industry academic partnerships and work through some of those kinds of questions like we were just talking about with getting access to the data inside of academia and working together around that. Again, that's going to be Monday, October 5th at 9 a.m. at the Health 2.0 conference.
Great. Well, I just want to thank all three of our speakers today for spending their valuable time talking about what I think are some really important issues for research and for the use of personal health data. Thanks to Camille, Isha, and Rumi. We really appreciate it at the HDE project. And thank you all for joining us as well. And we will see you next time.
Thanks.